Hello all. Today we're going to learn about the largest pharmaceutical company in Japan, Takeda Pharmaceutical. Let us know this company in a much better way. Takeda Pharmaceutical Company Limited is the largest pharmaceutical company in Japan and Asia and a top 15 pharmaceutical company. The company has over 30,000 employees worldwide and achieved $16.2 billion in revenue during the 2012 fiscal year. The company is focused on metabolic disorders, gastroenterology, neurology, inflammation as well as oncology through its independent subsidiary Millennium, the Takeda Oncology Company. Its headquarters is located in Chokyu, Osaka, and it has an office in Nihonbashi, Chuo, Tokyo. In January 2012, Fortune magazine ranked the Takeda Oncology Company as one of the 100 best companies to work for in the United States. Takeda Pharmaceuticals was founded on June 12, 1781 and was incorporated on January 29, 1925. In 1977, Takeda first entered the US pharmaceutical market by developing a joint venture with Abbott Laboratories called TAP Pharmaceuticals. Through TAP Pharmaceuticals, Takeda and Abbott launched the blockbusters Lupron, Leuprolide in 1985 and Prevacid, Lansoprazole in 1995. One of the firm's mainstay drugs is Actos, a compound in the thiazolidinedione class of drugs used in the treatment of type 2 diabetes. Launched in 1999, Actos has become the best-selling diabetes drug in the world with $4 billion in sales during the 2008 fiscal year. In February 2005, Takeda announced its acquisition of San Diego, California-based Strix, a company specialization in high-throughput X-ray crystallography, for $270 million. In February 2008, Takeda acquired the Japanese operations of Amgen and rights to a dozen of the California biotechnology company's pipeline candidates for the Japanese market. In March 2008, Takeda and Abbott Laboratories announced plans to conclude the 30-year-old joint venture, TAP Pharmaceuticals, that had over $3 billion in sales in its final year. The split resulted in Abbott acquiring US rights to Lupron and the drug's support staff. On the other hand, Takeda received rights to Prevacid and TAP's pipeline candidates. The move also increased Takeda's headcount by 3,000 employees. In April 2008, Takeda announced that it was acquiring Millennium Pharmaceuticals of Cambridge, Massachusetts, a company specializing in cancer drug research, for $8.8 billion. The acquisition brought in Velcade, a drug indicated for hematological malignancies, as well as a portfolio of pipeline candidates in the oncology, inflammation and cardiovascular therapeutic areas. Millennium now operates as an independent subsidiary serving all the global center of excellence in oncology under its new name, Millennium, the Takeda Oncology Company. In May 2008, the company licensed non-exclusively the RNAi technology platform developed by Alnylam Pharmaceuticals, creating a potentially long-term partnership between the companies. On May 19, 2011, Takeda Pharmaceutical and Nycomed announced that Takeda will acquire Nycomed for €9.6 billion. The acquisition was completed by September 30, 2011. On April 11, 2012, Takeda Pharmaceutical and URL Pharma announced that Takeda will acquire URL Pharma for $800 million. The acquisition is expected to be completed within 60 days. On 25 May 2012, Takeda announced the purchase of Brazilian pharmaceutical company Multilab by $540 million. On 26 September 2014, Takeda announced it would team up with Biomotive with the stated aim of identifying and developing new compounds over a 5-year period worth approximately $25 million. On 30 September 2014, Takeda announced its intention to expand collaborations with Macrogenies, valued up to $1.6 billion. The collaboration will focus on the co-development of the preclinical autoimmune compound MGD010. MGD010 is a therapy which targets the B-cell surface protein CD32B and CD79B and is indicated for lupus and rheumatoid arthritis. Takeda operates 2 primary bases in Japan in Osaka and Tokyo. Its United States subsidiary is based in Deerfield, Illinois, and all global operations outside of Japan and US are based in Opfikon, Zurich, Switzerland. The company maintains research and development sites in Osaka and Tsukuba, Japan, San Diego and San Francisco, United States, Cambridge, United Kingdom and Singapore. The company has manufacturing facilities in Japan, China, Indonesia, Italy and Ireland. Following the Nycomed acquisition, the Takeda manufacturing sites have been extended with facilities in Argentina, Austria, Belgium, Brazil, Denmark, Estonia, Germany, Mexico, Norway and Poland. Takeda has overseas marketing presences in the US, UK, France, Italy, Germany, Austria, Switzerland, Spain, China, Taiwan, Philippines, Thailand, Indonesia and Singapore. It has recently announced its first foray into Canada, Portugal, Spain, Mexico and Ireland. Some of the key products that Takeda produces on behalf of partners include Actos pioglitazone, type 2 diabetes, Amitiza lubiprostone, chronic idiopathic constipation, Basin voglibose, type 2 diabetes, Bennett risedronic acid, osteoporosis Japan, Blockpress candesartan, hypertension, Enbrel entanercept, inflammatory disease Japan, Dexilent, dexlansoprazole, gastroesophageal reflux disease, name changed to Dexilent in US, Lupron, Leuplin, Leuprolin, GnRH, agonist for prostate cancer and endometriosis, Prevacid, Takepron, Lansoprazole. Gastroesophageal reflux disease, Rosarum, Rameltion, insomnia, Uloric, Febuxostat, gout, Velcade, Bartezobib, multiple myeloma and mantle cell lymphoma, Millennium Pharmaceuticals. So we got to know about the various aspects of Takeda Pharmaceutical. We went through the company's history to its present day scenario. Hope the information was useful and have a good day ahead.